Good morning, viewers, and welcome back once again. And today's topic of the day is about a special population. But today's topic will be about pregnant women. So today's topic is very sensitive. And before I start this video, I would like to tell you that it's not a valid medical advice which I'm going to provide you. And please consult your doctor or your gynecologist before taking into consideration. So let's start. Pregnancy is like, when a woman is going to give birth to a child, there are a lot of things going in the woman's mind, and there are a lot of numerous things being going on, like, whether a pregnant woman should work out or not. And a lot of controversies there. But today I'm going to share you some important details, some important aspects, some scientific details about what really is the activity which a woman should do during pregnancy. And basically what happens is that pregnancy has got 3 stages. One is the first trimester, the first 3 months, which is very crucial, and then after that the second trimester, means that next 3 months, 6 months, and after the last trimester, the last part. So thing is that in these 3 stages, the woman has to go through various mental, emotional, and hormonal changes, and bodily changes occur, as we can know. And I'm not going to make it too scientific. I'm just trying to explain in a very simple manner. So my thing is that a lot of people are out there shouting that if you're pregnant you should not work out. But if somebody is having any kind of serious medical issues, then only she can take it into consideration about the physical activity. And people who are being advised bed rest, or they are going for some special treatment and to get pregnant, so only those women are basically being advised bed rest as advised by the doctor. But there are a lot of people who don't even want to work out, and even the doctor advised them to work out, then also they don't want to work out, thinking that something untoward incident might occur. And we will be showing also some videos, and we have got the one client she's already pregnant. She's 5 months pregnant, and she will be demonstrating the exercise also. But before that, I would like to share some evidence which has been already been published, and some I'll be discussing about some journals, because I will try as much as possible to make it simple and easy so that you people can understand. See, basically in 2012, the obstetrics and gynecology, the Journal of Obstetrics and Gynecology, in 2012 they have published one article, is physical exercise during pregnancy, a systemic review basically. And in this review it has been shown here that it's been written here, the main objective of this review is to see that the mother and the fetus, and the types of, and the frequency and the duration of exercise, and the rate of progression of exercise performed. So the study is based on this basically. So the findings were like this. I'm just going through the findings. So during that, it has been found out that exercise during pregnancy are associated with higher cardiorespiratory fitness, prevention of urinary incontinence, means they lose the bladder control, and some women have to use adult diapers post pregnancy. It happens because of the weaker pelvic muscles. And anyway, we'll be showing you the exercises, how to make your pelvic muscles strong. And they even have got low back pain, because what happens is that when your stomach is bulging out and you are having a big stomach, what happens is that the lordosis is aggravated basically. The lordotic acid aggravates, and it pulls the vertebral column anteriorly, and the arch of the lower back becomes prominent, and they have back pain because the abdominal muscles get hypotonic, they become weak, and they pull the vertebral column abnormally, and they have got tight hamstrings, and they get a lot of back pain. That is another thing. And exercise can reduce those low back pains, reduce symptoms of depression. Definitely, if you exercise, definitely endorphins is going to release in your body. You will have that happiness hormone flowing out in your brain, and you will feel good. And gestational weight gain, like temporary weight gain, will be reduced. Less of water retention in the body. And some people even have got gestational diabetes. And even in my case, my wife suffered from gestational blood pressure. Actually, she had a little bit of blood pressure during her last stage of in the third trimester. So we have controlled that after the advice from the doctor. So these are some of the things the pregnant woman has to face, and some even require insulin also. So exercise can ward off all these symptoms. So it's published in the 2012, and it has been clearly written here there is no association with reduction birth weight or premature preterm birth rate. Means if you work out, there is no risk of reduction in the birth weight of the baby, and there is also no risk of premature delivery. The type of exercise shows no different results. So the thing is that exercise basically are recommended based on the current guidelines. According to American College of Obstetrics and Gynecology, and it's been written here that moderate intensity, low impact aerobic exercise at least 3 times a week, including resistance training. So these are basically the guidelines which are being published in 2012, but now it's 2020. Remember that. So finally, it has been reported that physical exercise is definitely beneficial for women during pregnancy and also in the postpartum, means after pregnancy. It is not associated with risk for newborn and lead to changes in lifestyle that can imply long-term benefits. So definitely after exercise also, after pregnancy also, if you work out, definitely the mother and child both will have the benefits. And another review which was published is Boardman in December 4, 2018, and the topic of that article was exercise in pregnancy and children's cardiometabolic risk factors. And this is also a systemic review. Basically, it's a meta-analysis. So the background of that review is that maternal metabolic health during the prenatal period, means during pregnancy, is it has got, if somebody works out, it has got low risk of cardiometabolic issues. And many studies have focused on that, and during that study, a lot of things has taken into consideration, and the method they have used is they have used the method of the systemic review of Scoopers, Medline, Embase, Entrail, Sinel, and all these databases were searched in 2017, and after that they have come into this conclusion that prenatal exercise does not actually impact birth weight. Means the child, the birth of the baby, the body weight of the baby will be absolutely normal. There will be no change in the birth weight of the child, with the future child which is going to be delivered, and there is no change in fat mass or there is no negative results. So thing is that even in that review also in 2018 also it has been already proven. And another study which was basically done in 2019, that's a very big study, and the earlier study in 2018 which was done, and you can find it in in the website also. The protocol registration number I will give you the link in the description is CERD 4201-150-29163. So this is a clinical trial registration number which has already been done. And another research which was done in 2019, and in 2019 August 7, this article was published in the BMC Pregnancy and Childbirth, British Medical Council, I think. BMC Pregnancy and Childbirth. So it has been published in August 7, 2019, that the effect of vigorous intensity exercise in the third trimester of pregnancy, it has got only positive benefits. So the thing is that the methods they use before conducting the survey was they have searched the whole PubMed, the Medline, the Embase, the Cochrane library. Everything was searched, and few studies were being selected, and out of that the total number of studies which were selected was 32,080, and there were 5 randomized controlled trials, and the total number was 623 was included in the systemic review. And finally it has been found out that no significant difference existed in birth weight for infants of mothers who engaged in vigorous physical activity and those who existed in risk of small or gestational age-related issues. So thing is that only positive benefits have been found out. But before I come to a conclusion, I would like to share with you is that this is a finding which has been done on a lot of number of people, and it has been found out that until and unless if somebody is having any kind of serious medical issues during pregnancy, or otherwise one can engage in physical activity. And remember one thing, you can go up till high intensity exercises also till 90% of your maximum heart rate, but one should not go beyond 90%, because the thing is that if somebody has already been involved in exercise, suppose for an athlete, a CrossFit athlete or a weightlifter, or any person or any individual, a female who has been working on for so many years, and if she gets pregnant and during physical activity, she can go up till 90% of her maximum heart rate. So she can definitely involved in high intensity exercises without getting the risk of premature childbirth, and there is not an issue about premature delivery also, and there is not an issue about suffering from any kind of health related issue. So but beyond 90% of intensity, still research is at the very basic stage, at the nascent stage. Still it has to be found out, and you can also find this registration, the trial registration number in the website, and I will again give the link in description, CRD4 20181 02109. So this is the clinical registration number, and before concluding this video, I'll be sharing with some important exercises, and we have our client along with us, and she will demonstrate the workout. And she is already 5 months plus pregnant, and she has been actively engaged in weight training, and she has been training for almost 1.5 years, and her husband is also a certified trainer. And so let's start with the workout. We'll be showing you some basic exercises, and during the exercise I will also inform you that what are the do's and don'ts you have to follow during exercise. So let's see what kind of exercise we need to do. Start. So as promised earlier, so now we are into the exercise section now, and we have Papuri here with us. So Papuri, tell me how, which is your this is the 5th month, I think, right?
Yeah, I've crossed my 5th month.
Okay.
This is 22 weeks running.
Mm-hmm.
No, sorry, I've completed my 22 weeks, and this is 23rd.
23rd.
Running.
Okay, that's great. So you have been your training continuously?
Yes.
Okay, fine. So let's start with the warm up. We have already done the warm up. And just to keep the video short, let me tell you one thing, that during this pregnancy, the first trimester is already over, right? And in the second trimester, thing is that you have to take some important care. Like you cannot lie down on the floor and work out, because what happens is that if you lie down on the floor, what will happen is you will not be able to breathe properly. So to do some chest exercises, you will use the incline bench, and or you can use the machine chest press. And if you want to do some core exercises, you can do it sitting on a chair, but you have to avoid certain exercises, basically especially on the floor. Okay, so let's start with the bench press, incline bench press. Okay, lie down. Just for instruction purpose only, we are not using any weight, because he has already trained early in the morning. Okay, lie down. Okay, start. Good. Okay. Good. Okay, fine. Okay, so that's it. And suppose if somebody is not able to do with chest workout with weights, they can go for some incline push-ups, just to hit the upper chest. And she has already been doing weight training for quite a long time. So that's why she is able to do. And now we'll do some leg workout. See, during pregnancy, one should always go for the full body workout. Show us some squats. Okay. Good. See, look at the stance, because her belly is big. That's why it will compress the abdomen. That's why she is keeping a big stance. Okay. She is doing sumo squats. Okay. Good, very good. Okay, fine. So this doing sumo squats just to get the range of motion, because otherwise what will happen, if she squats with narrow stance, what will happen, it will hit the belly. Then go for some back workout. So you guys might be thinking that why we are just concentrating more on weight training, because at this point of time the baby inside her is feeding most of the nutrition. So in order to maintain the muscle mass and the density of bones, resistance training is the best option. Okay? Okay. Sit down. Okay, start. Wait, is okay. Okay, little bit. Fine. So you can do 2 to 3 sets, 2 to 3 sets of this, and any exercise. And always remember, use light weights, and you can use moderately high weights also if you are a professional lifter. And in her case, she is not professional, but she has been an avid fitness enthusiast. So she is always use lighter weights or moderately high weights. But remember, you should not go till failure. If you can do 15 repetitions with a particular weight, you will only do either 2 or 3 short, 2 or 3 repetitions lesser than what you have targeted, because that is called 2 or 3 rep short of failure. And finally, we'll do some exercises like for the abdominal area. We'll sit down over here, facing that side. So the most important part is that during this period, most women have got very less control over their, they have got urge to urinate most of the time, because the belly is protruded, your pelvic muscles are weak. So right now, in order to avoid that, in order to avoid urinary incontinency, you have to strengthen the pelvic muscle. So you have to sit down on the bench like this, keeping your legs forward comfortably, and you need to pull your abs inside a little bit. And when you have the urge to urination, you need to try to control them, moderately, so that post-pregnancy you will not have any kind of that issue, because otherwise there are a lot of women who faces quite a lot of issues having urinary incontinency. So that is another issue, like lack of weak abdominal muscles. But I don't think so it's going to happen in your for supporting us. She has already walked out early in the morning. I call her up again just to show you the more, because I'm really privileged. Like in my entire career, she is the first woman whom I have been training, and actually she is being trained by her husband. The thing is that just for the video. And remember, women should always work out, and pregnancy is not a disease. You can do all sort of exercises, but definitely you need to get the guidance from the doctor, and always train under a very qualified and experienced professional. Otherwise, do not take any kind of risk.
And thank you so much, sir, for guiding us. No doubt that my husband is training me, but of course always under the guidance of you, sir.